Dr. Mwangi. Please extend our sincere appreciation to Dr. Nelson. I definitely understand the pull on her time. Thank you for your very kind remarks. And certainly, yes, we are going to be around. And yes, we are going to look into the community of quality. That's something we think is going to be very useful as we continue on this journey. Thank you once again, and thank you to the bigger CDC family for the support. I am now going to call on Francis. Francis is he comes from a health center 4, and he's going to tell us the story of Sembabule Health Center 4. Francis, I'm going to hand over to you. If you have slides to share, please share. You have 5 minutes to go, and then we would move on to our next speaker, Mary. Francis, the floor is yours. Welcome. Thank you.
Thank you, Professor, for this opportunity given to us. Allow me to appreciate and recognize all the invited guests to attend this meeting. I'm Arinaitwe Francis, Laboratory Manager, Sembabule Center 4. Sembabule Center 4 is located in central region of Uganda, in Maugora North, Sembabule district. Sembabule Center 4 laboratory serves a catchment of 7 sub-counties, including 2 town councils. It has a catchment of 32,553 population that it serves. Our journey to accreditation has been a long journey which started long way back in 2012 when Sembabule Center 4 Laboratory was accredited, was enrolled in cohort 2 SRAMPTA. That's when we started with quality laboratory management systems, and the baseline of our entrance was star 0, where we scored 68 points. That was our kickoff. In 2013, we had a final cohort audit 2, and our laboratory scored a star 2, which was a good achievement. During the end of 2013, we had an exit audit, and our laboratory scored a star 3. And we were enrolled in SRAMPTA. We were enrolled in ASREM in 2015, whereby we had a baseline audit and still we had a star 3. In 2015, we had a midterm audit and we had a backslide because there was a lot to be done. It was a hard journey to move, so we scored a star 2. But we persisted and we couldn't give up. In 2017, our lab had a cohort 3 exit audit and we scored a star 3. 2018, ASREM audit was conducted and our laboratory still attained a star 3, which gave us a good kickoff to join accreditation by SANAS. So in 2020, October, we had a SANAS audit and our laboratory was approved to attain international audit with only 1 non-conformity, which was a very great achievement. Our accreditation has really benefited and has changed the environment where Sembabule Health Center 4 Laboratory is located and has impacted on both patients whereby our patients that attend our laboratory increased from 900 to 20,000 per month, which was a very great achievement. This was due because of quality work services that our facility do serve to the community. It has increased on the test menu, the tests that the laboratory could run from 10 to 17 tests. It has reduced on the turnaround time, on the waiting time. Our patients could wait for so long before, but because of quality services, our turnaround time has really greatly improved and our customers have really appreciated. It has also impacted on clinicians. Clinicians have also benefited from this, from doing performance, because all the tests, all the clients that come to the laboratory, to the facility, they are all tested. They are confirmed before prescription. So the clients are served after making a proper and good diagnosis. So it has also helped the facility to reduce on stockouts because performance was minimized. It has impacted on staff because staffs have gained skills. They have been trained in several trainings, which have helped us, also our staff, to share the knowledge and skills to the lower facilities that we do serve. It has helped us to improve our working environment, whereby we had 2-roomed lab, but now, as we talk, we have around 6-roomed laboratory with a very good waiting area, which has also really excited our customers. It has also impacted on students. We used to have few students who could come to do their practicum here, but now we have at least a good number of students who come and learn and get knowledge from our laboratory. Though we have moved through this journey, there has been challenges, of course. One of them is human resource. Being a health center 4, we have faced a challenge of human resource. We are only 6 staff in the laboratory, but that one couldn't limit us from achieving the accreditation. It couldn't stop us from really attaining quality services and give it to our customers. That is the journey really we have passed through for accreditation. We really appreciate our thanks, and a lot of appreciation goes to the Ministry of Health, CDC, Global Health, IP, Iraqi Health Sciences Program, district leadership, facility leadership, and the laboratory staff, and all the stakeholders that really supported Sembabule Center 4. This is possible. Our facilities can be accredited, can achieve accreditation, and can give quality healthcare services. Thank you, Professor, for this opportunity. I also wish you all the best. Thank you.
Hi, Francis. Thank you. That's a great story. And there is a reason why we chose Sembabule Health Center 4. And thank you and your team and the management out there for a phenomenal job. It's true that it can be done. It's true that you've done it. And we like your strength. We like the enthusiasm around it. We're really glad to have you. Very quickly, I'm going to go on. From Katakwi, we have Mary Goretti, who is sitting in. I think she's the quality officer, and she's going to be sitting in. Mary, please come on. If you have any slides, please share them. And you have 5 minutes. Thank you. Welcome.
Thank you, Prof. Good afternoon, good evening, good morning, everyone. This is Goretti Ajumo, Katakwi Hospital Laboratory. Katakwi Hospital is located in Katakwi District, Eastern Uganda, neighboring Karamoja region, and we have an catchment area of 40,000 people. Katakwi was one of the laboratories that were enrolled in the SLAMTA supplemental program by Global. Usually for a lab to provide quality services to its users, there must be an established quality management system, which comprises of all documented procedures, both managerial and technical. It also involves management commitments for this system to be maintained or sustained. This was not the case for Katakwi, a lab that was previously in the SLAMTA program between 2016 and 2017. We had 3 lab staff trained by then, but all of them were transferred out of the facility. In August 2018, Katakwi had a SNFTA baseline audit where we had a score of 135 points and a percentage score of 48%, that giving us a star 0 at the baseline audit. At that time, we had 2 new staff, 2 staff already in the system, giving us a total of 4 lab staff who did not have any idea of what a quality management system is, how it is established, any documentation required, and how it should be implemented in line with the requirements of the ISO 15189. After that audit, we were enrolled in the SLAMTA supplemental training by Global in partnership with MOH, UHNLS, and TASO, Sorot Region Project. 2 lab staff were trained, the quality manager and the laboratory manager, in various aspects of the quality management system. 12 quality essentials, quality system essentials were one of them and one of them was documents and records. We also had internal audit trainings, all by Global. This was to help us establish our quality management system in Katakwi Hospital Laboratory. The training was in phases. After each phase, there was an on-site mentorship for the lab staff by trained mentors assigned specifically for Katakwi Hospital Lab. And we really appreciate the support from those mentors and the trainers. In April 2019, after phase 1 of the trainings, we had a midterm audit to check the process in terms of establishment of the quality management system. We scored 186 points and a percentage score of 69%, giving us a star 2. That was the midterm audit. This was followed with an exit audit in July 2019, giving us a score of 220 points, a percentage of 81.78, giving us star 3. We proceeded with the SLM audit in September 2019. Using the SLIPTA checklist, we scored 241 points and a percentage score of 90.3%, giving us a star 4 at the SLM audit. And currently, Katakwi is fast-tracked for SANAS accreditation, all through the support of TASO, Sorot Region Project, Global, and CDC. The journey has had pitfalls, but we have many benefits. And through the SLAMTA trainings, we're able to establish our system. We're able to document all procedures in line with the requirements of the ISO 15189. We had our set policies that we use in our quality management system. The hospital management, represented by the medical superintendent, who is also the lab director, got involved in the lab management. And this was a very big achievement because rarely do we find a medical soap getting involved in lab services. We also had challenges, and these challenges were actually discussed with the hospital management. We shared ideas on how to on how to overcome these challenges and ideas on how to sustain our quality management system in the lab. Previously, the lab never had a standard request form. Our results were never reviewed. We never owned our results as staff, and we had never done any competence assessment. But now we can review our results. We've done our competence assessment. We can own our results and with confidence that it's me who did this test. That's a great achievement in Katakwi Hospital Lab. We have our IQCs done, EQA performance, and we're able to monitor our EQA performance. We also got more 4 lab staff, giving us a total of 8 lab staff. And also our patients have increased from an average of 2,200 to 3,000 per month as of December 2020. More personnel. The more personnel we got has actually improved our efficiency and effectiveness of our laboratory, all thanks to the trainings we had and the knowledge and skills that we got from those trainings. We've had reduced turnaround time since now we have more personnel in each section of the lab. Our customers, like the clinicians, now have confidence in our lab results. General customer complaints have reduced. We conduct customer surveys to ascertain the level of our customer satisfaction. By the time we started the SLAMTA trainings, we never had any customer survey done, but now we have so far done 2 customer surveys, 2019, 2020, and due for 2021 next month. It has also improved work relationship between lab personnel and the clinicians through discussing challenges and sharing ideas in the clinician lab meetings. Lab can now hold its management reviews with the top hospital management, including the departmental heads. We can now monitor our supplies to reduce expiries and stockouts. Generally, the training from SLAMTA has really helped us. It has made us know that without quality in the lab, it means we are not giving the right result to these patients. The patients will never have a clear view of what is happening in their health, and we would not have helped the clinicians to use our results correctly to help these patients. In conclusion, I will say it doesn't matter the geographical location of the lab, but what matters is the lab management commitment to satisfy its customers through proper and quality services. I would like to appreciate the trainings and the mentorships we received through Global. Particularly, I would appreciate my trainers, my mentors, appreciate Ministry of Health, UHNLS, CDC, our IP TASO, the hospital management, and the district health officer for their support. Thank you, Global, for this opportunity, for letting Katakwi showcase or tell their story from a star 0 to now a lab that is fast-tracked for accreditation. Thank you.
I don't see any hands coming up at the time. Mary, yes. Timothy, please unmute and.
Yeah, thank you, Prof. Thank you for this whole presentation. Mine is to make an inquiry. I don't know what is the sustainability plan. I mean, when there is a transition, and we know that Global has definitely done a good job. We are expecting quite a lot from JCRC also. So I'm a bit wondering, I don't know what CDC's plan is, what Ministry of Health's plan is. Is Global going to be around to at least work with JCRC? I mean, as part of the whole transition, because we know that, of course, we are looking forward to a lot from JCRC, but I think it's important for every transition, especially that the previous person who has been there, at least you get to work with the new upcoming person, just for continuity. Thank you.
Thank you, Timothy. I'm going to assume that was a comment, since I am not at liberty to be able to make decisions that affect other partners. A global healthcare as an institution is in Uganda. We have plenty of work we're doing in Uganda, and we'll be very glad to support the ministry as we've always supported, and any other partner will continue to support all partners with the work that we do. So from a global healthcare, that's what we'll do. Thank you. Any other hands?
Yes, there's another hand, yes, sir.
Yes, who's that?
Yeah. This is Timothy also.
Yes, Timothy, another Timothy, yes.
Yeah. I would like to thank you for that great work. You have made us so proud in our profession. I work with the PNFP, and we have really liked to improve this rather very, very key issue of accreditation in our laboratory, but it's so expensive for our management to take on. How can we get there? They're global to support us, to assist us. I've had some few laboratories which I could not expect to be in this process when they have reached very far, and I'm really challenged. I feel like we should also join it. I want to minister to help us, and Dr. Nawada, how can we join the line of accreditation? Thank you very much.
I guess there are government channels. There is a Department of Quality at UNHLDS that could support you. As an independent institution, we have a whole institution that could support you as well. But as a government facility, it would be nice to look into the government channels that are available for you before you approach us. But we'll be very glad to have this conversation with you offline. Thank you.
You're welcome, sir.
Is there one more hand that in the interest of time, is there one more? Mr. Mwenda, my good friend, please turn on your microphone and go at it.
Yes, Professor, good afternoon, everyone.
Good afternoon.
Yes, I think this is quite an excellent experience, which I think Malawi can also learn from. But I just wanted to have a general perspective. The challenges which were quite general, which were quite even specific, maybe those challenges had not, if it had not been handled well, probably we could not have reached where we are. Can we just maybe isolate one or two challenges and how we manage to step over those challenges so that we can learn from? Over.
I knew if there was one man who was going to put me in the hot shoe, it was going to be you. Well, let me just pick a really low-hanging fruit challenge. It's the challenge of this is too much work, or this is not in my job description, or we need to be paid more to do this. And that indeed was a very big challenge. That indeed was a very big challenge. But again, that's a challenge which we were able to, when I talk about mind shift, indeed, it was really a mind shift game to be able to explain to our technologists, our technicians, and our scientists out in the field that if you're going to go through any of these academic institutions, the whole idea of a good laboratory practice is paramount to anything else that you're going to do. And once we were able to have that conversation with the management team, and the management team was able to understand the direction in which we're going to, and then have the conversation as well with the lab team, the actual people on the bench. And above all, when we were able to bring it to bear that everybody in the laboratory is a potential patient. You might not be a patient in your own lab, but you might be a patient in somebody else's lab. And woe betide you if when you go to somebody else's lab, they behave the way you behave in your own lab. And so once that conversation came to bear, it took us a long time. It wasn't 2 days, it wasn't 2 weeks, and it wasn't 2 months. That was a long conversation, a lot of motivational talk, a lot of inspiration, and that is where the mind shift came from. But that was a big one. Too much work, more salaries, not in our job description. That was a massive challenge. That was a massive challenge. I hope I helped.
Thank you, sir. Thank you, sir.
Thank you. Thank you. Thank you. One last one before I say thank you. Is there any last hand? I will just be able to take one.
Hello, everyone.
Yes. Richard, please
yes,
go on.
Good evening. And good evening and well done, the previous speakers. I want to appreciate Mr. Francis Arinaitwe from Sembabule Health Center 4 and the madam from Katakwi. Some of those places are hard to reach, but you can see they have been able to perform very well. And I really want to appreciate them. And then to the IPs, I really wish to request you to support such people and such facilities with an extra hand, because really it is not so, the situation is not so normal like some of the places that are supposed to perform better, because there are facilities in the cities and municipalities that have bigger catchment area, access to better resources and better working environments that are not accredited. So if these places are able to have accredited labs, they need to get an extra hand of help. Thank you very much. Good evening.
Oh, thank you very much indeed. At this point, I'm sorry, we have to bring this to a close. This has been very long. And again, my sincere appreciation to Dr. Nelson, who could not stay much longer, to Dr. Mwangi, to Dr. Nabada, and to your, Francis and Mary for your presentations and for shedding some more light on the work that we've done. My sincere appreciation to everybody who attended. This was long today. We just wanted to reflect on all the work that we've done. You're going to have us around, and look forward to our invitations to more webinars on other aspects of quality management systems and the whole management system standards. Thank you, thank you, thank you. It's Thursday. Wherever you are, a few hours to the weekend, which starts tomorrow evening. Have a wonderful weekend, and thank you, thank you.